Good afternoon, students. My topic of discussion is degluttition. I'll be dealing the topic under following headings: definition, rate, components, mechanism, and finally some applied physiology. Degluttition or swallowing is a complex coordinated event which leads to passage of food from mouth to stomach. Average rate being 600 swallows per day, of which we can divide roughly 200 swallows during drinking and eating, 350 when you are awake without food, and 50 during sleep. The component involves mainly three phases. First and foremost phase is the oral phase, which is a voluntary phase. Second phase is the pharyngeal phase, and third phase is the esophageal phase. Both pharyngeal and esophageal phase is a involuntary phase or reflex phase. Now we will see in detail each one phase. First, the oral phase. In this, food passes from mouth to the oropharynx with the help of the tongue. So what is actually happening is that the tip of the tongue pressed against the hard palate. This pushes the bolus back into the posterior part of the tongue, which is known as the preparatory position. Next, the tongue moves upward, forcing the bolus into the oropharynx. So what is happening here is food in the mouth, the tongue presses against the hard palate and push the bolus into the posterior part of the pharynx, which is shown as the arrow here. So into the oropharynx. Now we will see the second phase of deglutition, that is the pharyngeal phase or the second stage. So what is happening? The passage of food from the pharynx into the esophagus. It is an involuntary stage which involves a reflex process which lasts less than 2 seconds. So once the food is in the oropharynx, it can go into 4 possible outlets, which are back into the mouth, up to the nasopharynx, and into the larynx and the trachea, which is shown in the figure, and down to the esophagus. But once the food in the oropharynx, a reflex known as deglutition reflex occurs, which ensures that the food passes down to the esophagus and not to any other opening. Now we will see the deglutition reflex. So the deglutition reflex, food is the stimulus that is present in the posterior part of the pharynx. It will activate the touch receptors which is present in the soft palate, facial pillars and posterior pharyngeal wall. The impulse is then carried by cranial nerves 5, 9 and 10 to the deglutition center, which is located in the medulla and lower pons. So this deglutition center is close by the respiratory center. So from there the information is passed via efferent nerves which involve cranial nerve 5, 7, 10 and 12 to the pharyngeal musculature. Then a series of automatic muscle contraction takes place. As a result of this muscle contraction, entry back to the each outlet that is shown in the previous slide is prevented. So entry back to the mouth is prevented. We will see how. So because of this deglutition reflex, approximation of the posterior facial pillars happen, as well as there is the elevation of the posterior part of the tongue. This leads to closure of the mouth entry. And the muscles involved in the tongue is mylohyoid, styloglossus and hyoglossus. Now, the entry back into the nasopharynx, how it is prevented? It is prevented by elevation of the soft palate and closure of the posterior nares. So, the muscle involved is levator veli palatini. Then next opening is into the larynx and airway. So, how it is prevented? By the approximation of the vocal cords which lead to the closure of the glottis. At the same time, the larynx move upward and forward by the neck muscle, so that it will be covered by the epiglottis. As well as there is a deglutition apnea also taking place during this phase. So all these features prevent the entry of food into the respiratory tract. So now we'll see what do you mean by the deglutition apnea. So what is apnea? Apnea means cessation of breathing. So deglutition apnea means temporary cessation of breathing during swallowing or deglutition. Why it happens? It happens because the deglutition center will inhibit the respiratory center for a few seconds, which lasts for less than 2 seconds. It is actually a protective mechanism that prevents the entry of food into the respiratory tract. Now, the fourth outlet is into the esophagus. So, deglutition reflex has made a series of muscle contraction in the pharynx. So, the superior constrictor muscle contracts and pushes the bolus deep into the pharynx nearer to the opening of the esophagus. So, the upper opening of the esophagus is guarded by the upper esophageal sphincter. So, the upper esophageal sphincter relaxes and the food bolus enters into the esophagus. So, now our next phase is the esophageal phase. So, this is the summary of the what is taken before. You can see first one, the hard palate is shown, tongue is shown, glottis, trachea, esophagus, upper esophageal sphincter is shown and the epiglottis is shown. So, food is there in the posterior part of the tongue which is pushed by the tongue. So, it is now in the oropharynx. Now, what happens? From the oropharynx, deglutition reflex occur and there is a series of muscle contraction. So, in the next, it is prevented from entry back into the mouth by the elevation of the tongue as well as the approximation of the posterior facial pillars. Then back into the nasal pharynx by the elevation of the soft palate. Then entry back into the respiratory system is prevented by closure of the glottis with the epiglottis which is shown in the blue color. Then upper esophageal sphincter opens and fourth phase is that bolus enters the esophagus. Now where the food is in the esophagus. Now we will see the esophageal phase. So esophageal phase, which is a third stage, it is again a involuntary stage and it involves a reflex. So it involves a primary peristalsis and as well as the secondary peristalsis, and also the gravity helps in propelling down the food through the esophagus. So now we will see the esophageal space. So primary peristalsis usually begin in the upper esophageal sphincter. Once the food enters the upper part of the esophagus, upper esophageal sphincter close so that food is not gone back into the pharynx. Then primary peristalsis occurs. What is this primary peristalsis? A wave of peristaltic constriction occur behind the food so that food is pushed down the esophagus, and this wave of peristalsis is at the approximate speed of 4 cm per second and it lasts for 10 seconds. So once the food reaches the lower esophageal sphincter, what happens? That sphincter relaxes. So this is explained with a diagram. You can see a bolus of food, esophagus upper part, this wave of constriction has occurred here. So what happened? This food bolus is pushed downward and this wave of constriction is moving along the entire length of the esophagus, and finally the bolus has reached the lower esophageal sphincter and the lower esophageal sphincter opens up and food enters into the stomach. Now, so when I told you the gravity also helps in the propelling food through the esophagus. So when the person is in an upright position, liquid and semi-solid food will empty faster into the stomach due to the effect of gravity. So what is secondary peristalsis? So after the primary peristalsis, whatever food is left behind in the esophagus is cleared by the secondary peristalsis. So secondary peristalsis occurs due to the distension of the esophagus by the food that is present in the esophagus that is left behind. Okay. Then this will activate what? Our intrinsic nervous system. So the intrinsic nervous system to the GI tract, as you all know, is named as enteric nervous system, is involved in the secondary peristalsis. Then this secondary peristalsis continues until all the food reaches the stomach. Now, the food has reached the lower esophageal sphincter. A few words about the anatomy of the lower esophageal sphincter. Where it is located? It is located 3 cm above the gastroesophageal junction. It is always closed, tonically active or always closed. Why it is always closed? If at all it is not closed properly, the food content whatever inside the stomach will regurgitate back into the esophagus, causing damage to the mucosa of the esophagus, which is the basis of pathophysiology of gastroesophageal reflux disease, which I will be explaining. Then, what are the components of lower esophageal sphincter? So, the components of lower esophageal sphincter, it has a intrinsic sphincter which is formed by the smooth muscles of the esophagus. Then, it has an external sphincter which is formed by the crural part of the diaphragm, and third, it has a flap valve which is formed by the sling or oblique fibers of the stomach wall. So, this is shown in this picture. You can see the lower esophageal sphincter has mainly 3 components. Internal sphincter is formed by the smooth muscles of the esophagus, and external sphincter by crural part of the diaphragm, which is marked here, and third one is the flap valve is formed by the sling fibers of the oblique muscles of the stomach. So, these 3 form the lower esophageal sphincter. So, who controls the tone of the lower esophageal sphincter? It is under the control of the vagus nerve. So, vagus nerve that is directly innervating the lower esophageal sphincter releases acetylcholine, leading to contraction. And suppose the vagus nerve that is synapsing in the interneurons, which is in the meandric plexus and Meissner's plexus, they release a nitric oxide and vasoactive intestinal polypeptide, which will cause the relaxation of the lower esophageal sphincter. Now, finally, the applied physiology. The disorders of swallowing, mainly the patient complain to you with the symptoms of dysphagia, means difficulty in swallowing. Odonophagia means painful swallowing. These are the 2 common complaints that the patient give whether when they are having any disorders of swallowing. Now, we will see oral phase disorders. Oral phase disorders involve ulcers anywhere in the mouth, tooth or tongue, and oral cancers, then cleft lip and cleft palate. So, it is a birth condition. You can see there is a connection between the palate and the nose as well as the lip and the nose. So, when the baby feeds, the food may regurgitate into the nose. So, this is a birth condition usually corrected by the surgical interventions. Now pharyngeal phase disorders, which include symptoms like nasal regurgitation of food and tracheal aspiration. The patient present to you with the complaints of food coming out through the nose, or they were having tracheal aspiration and recurrent pneumonia. So, what is the causes for this? Any lesion in the degluttition pathway, the reflex arc, it can lead to phases of the pharyngeal phase disorders. Okay. So, what are swallowing center? Which is the swallowing center? That is located in the medulla and lower pons. If that is affected by bulbar or pseudopulbar palsy, this can lead to a pharyngeal phase disorder. Next, 9th or 10th nerve, cranial nerve paralysis, this can lead to a disorder. And any neuromuscular junction disorder, example myasthenia gravis. I hope you know what is myasthenia gravis. So, the muscles or any muscle disorder like muscle dystrophy, or due to the effect of anesthesia, if the pharyngeal muscles are weak, that time also this pharyngeal phase disorder can happen. Now, the next one is the esophageal disorder, which include achalasia cardia and gastroesophageal reflux disease, which is a long topic that I will be dealing in the next class. Thank you.